And now, here's your host, Alessandra Torresani.
Well, I am super thrilled to be here with Devika Bhushan. And I am just thrilled for many reasons because I feel like I know you personally through social media and through other people who live openly and proudly with bipolar disorder. But I also feel like I'm a super fan because my mom was the one that actually introduced me to you, whether you know this or not, through an article when I believe I was just newly pregnant, or I can't remember where I was along the pregnancy spectrum, but you were the acting surgeon general. You were talking about living with bipolar disorder, proudly making this stigma free. It blew my mind, and I was just so excited because you were a pediatrician, and I was like, oh my gosh, she's gonna help my baby. Like, there were just so many things. So we have so much to get into, and I'm so excited to finally be having this conversation with you. And I know that you are you are doing such important work for those of us who live with mental illnesses and are trying as hard as we can to make it as stigma free as possible. So, first and foremost, Devika, I want to know, how did you decide, like, you know what? I am going to be this powerhouse in this mental health world, in this whole, genre, if you will. How did you get involved? Was this something that came after your diagnosis? Was it something you were passionate about before? We know that you're passionate about helping children. What is the story of Devika?
Wow. Well, thank you for having me on, Alessandra. And
Oh,
I know that this conversation has been some time in the
yeah.
making, and I'm
Yes.
really excited that we're having it. And I just wanted a quick shout out for anyone who saw us speak on the NAMI
That's right.
IG Live last year.
Yes.
So this was, I think it was May 18th. So
Right?
Mental Health Day of Action. You and I got together on the NAMI Communicate
Yep.
channel. We had our first conversation, and we got to connect on all of these
Yeah.
levels of, being stigma busters, being new moms,
Yes.
and all of what those phases of our life have entailed. So that was such a joyful
Oh,
conversation. And I've been looking forward to this one, this follow up, which is almost a year later,
wow. I
for
can't
some
even
time.
believe
So
that it's
thank
been a
you.
year. That's so wild.
I know it's absolutely wild.
Okay.
Um, but yeah, I would love to hear your answer to the same question, even though
Yeah.
I'm not interviewing you in this context. But for me, the way that I came to wanting to feel like a full sense of authenticity, the person that I was externally and publicly, as well as the person I was internally and privately, I wanted those people to be the same.
Sure.
And I wanted for whatever role that I could play in this arena
Hmm.
of busting the stigma of living with a serious mental illness, um, and highlighting the parts of that journey that also centered on recovery and what
Right.
that could look like,
Hmm.
right? Because, as you know, so much of what we still think about as associated with bipolar disorder are stereotypes based on people at their most sick
Hmm.
and least well, right? And that's just not reality, and
No.
um that's not the truth or the future for anyone who is sick in this moment,
Sure.
right?
Sure.
And that's both the lie and the external stigma and stereotypes around mental illness, that the ill moments last forever and the
Hmm.
ill moments define the rest of your reality or the rest of your life. And I really wanted to be part of the narrative that, okay, it's a really difficult set of experiences that you walk through, but equally, walking through those really difficult experiences helps to mold you
Oh, yeah.
and shape you into a more complicated, interesting, capable human
Yeah.
being. At the end of the day, it makes you a better parent,
Hmm.
a better colleague and boss. It makes you a better doctor if that's what you end up doing. It just teaches you all of these hard won skills, wisdom, empathy that you wouldn't come about in other walks of
Hmm.
life. And so I wanted people to understand um, that there are real superpowers
Yes.
and strengths and assets that can come from a mental illness journey. And so many of us, when we sort of come into a place in our lives where we are successful in some way, we tend to bury the parts of ourselves that were
Right.
less than, or that we had to hide away for one reason or another, during, let's say, the struggles, or
Right.
during our ascent, or
Right.
our journey in whatever way. And so I just wanted to be part of the growing narrative that you can live well
Mm-hmm.
with mental illness, and that it does not have to be something we're ashamed of. It does not have to feel like any different than having a serious health condition like
Sure.
diabetes or a thyroid condition, right?
Or a broken leg. Like sometimes you can fix things. You know what I mean? Like I think that that's
Exactly,
you're
exactly.
right, and I think that that's a lot of the problems behind it is like you don't see the other side of when those are thriving and living their best lives and the best versions of themselves. One of my questions that a lot of people have written in asking about this is, for me, a question that's always asked is, when did you feel comfortable sharing your story on set as a working actress? And it was one of those
Yes.
things where for me, I started to share a little bit, and then I had people around me going, "Oh no, you don't want to tell anyone because it's going to label you as difficult and like very diva
Mhm.
behavior," and so
Yeah.
that kind of shut me down. But I also am, I feel like I live in a fantasy world being an actor. Like I feel like that's a fantasy job. So when it comes to a real job, such as being a doctor, what are kind of the moments for you where you're like, okay, now's the time to share because it's going to help out? Were you ever fearful? Like if I do share, like maybe I'm going to be kicked off the board. I don't know. Like what's kind of the
Yeah.
struggle or the battle there?
Such a good question. And first, for the record, you have a real job, as real as my job.
Yeah, but it's a little more
And it's
fantasy,
amazing.
it's a little more fantasy.
You're in a more creative space.
Sure.
Let's just put it that way.
I play a
Um,
doctor on TV. I'm just not an actual doctor. Yeah.
there you go. There you go. So it's interesting because if I cast my eye back, I was first symptomatic in 2009. I had the correct diagnosis and set of treatments came to me about 2.5 years later in
Wow.
2011. And then I had two more episodes while I was in training. And those were in, let's see, 2014 and 2015.
Wow.
Okay. So I would say, just looking back at that whole trajectory, I was very closeted
Mm.
while I was sick,
Hmm.
and in and out of my training program. I was taking leaves of absences to deal with those episodes.
Sure.
And those, by the way, just for the listeners and viewers to know, people with bipolar disorder are very sensitive to sleep loss and circadian rhythm shifts,
Yeah.
and all of those episodes essentially happened after like 3 or 4 switches between days and nights that were
Sure.
very rapid. And one of them happened after a long 28 or 30-hour call,
Wow.
where you're awake for that amount of time and then more, which is not great for anybody's health. And
No.
there's a lot of us who are crusading to do away with those sorts of shifts because, pilots can't do that
No.
because we've decided that's not safe. And it's just as unsafe for doctors to be doing it. But that's a conversation for another time. In those early phases where I was not yet sure what role bipolar disorder was going to play in my life,
Yeah.
where I felt like my stability and my ability to be myself
Mm.
were not fully yet in my own control.
Sure. Sure.
That I hadn't quite figured out, like, what is this diagnosis? What is this journey going to look like?
Hmm.
And I kept getting sick, and I didn't feel like I could rely on my stability or my brain, right?
Which, as a doctor, I'm sure that's something that you have been able to rely on is the structure and the
Yes.
stability of. So that's what's
Yes.
I think for to paint the picture, like that's what makes it even more out of your
Yes.
control of like what's going on. Yeah.
Yeah. Regardless of what you do as a profession, I mean, when you are mentally not yourself,
Yeah.
and when your brain is doing something of its own that you don't yet understand, it is really bewildering because you lose all of these really fundamental parts of yourself: how you
Sure.
think, how you feel, your sense of self, your energy. your just everything that
Sure.
the brain controls,
Yeah.
which is really our sense of self, is evaporated. And so that's really scary, especially the first couple of times you
Mm,
experience it and you have no idea, is this ever going to come back to me? When, how, with what
of
methods?
course.
And so I would say those early years, not only was it me coming to terms with what is this illness and
Hmm.
what is it going to look like in my life and how will it affect me and how will I stay well from it, but I also had this very deep internalized self stigma around
Mm,
the diagnosis because of the world that we live in, but
yeah.
more acutely because of the attitudes of some of my peers towards patients who had this condition. And,
Wow.
they would say things like, I remember one time I was coming into the hospital and taking sign out from the person who had been on overnight. And we had, I work in pediatrics. So I think it was a 15 or a 16-year-old who had been admitted overnight for an asthma flare
Hmm.
that we were helping her through. And she also happened to have bipolar disorder, and that had nothing to do with her admission
Hmm.
or her treatment.
Hmm.
However, there was an altercation between her and her roommate. So there were two patients to every room. And it was the way that experience or that set of circumstances was explained to me was, hey, this patient came in overnight. We did this for her asthma. And oh, by the way, she got into a fight with her bedmate. And apparently it was the bedmate. She's saying it's a bedmate's fault, but who really knows, because she has bipolar disorder. So you can't really trust what she's saying. So these kinds of statements
Just little
were par
digs.
for the course,
Yeah.
just tossed out as if it's, bipolar disorder is something that affects them over
Yeah.
there away from us. It couldn't possibly affect any of us
No.
in this, sanctitude of a
No.
room that we're sitting in. So it was really hard for me to come to believe that if I were to share this about myself with some of these colleagues, I'm not saying everybody was in this
Yeah.
boat, but it was pervasive enough that I heard these sorts of sentiments enough. And I felt like my worth as a peer, as a colleague, as a physician would definitely be tainted
Yes.
to some people if they knew.
Sure, because they're going to say, "Oh, she's going to be the one that's going to snap and she's not going to be able to handle
Mm.
the pressure." And there's so much judgment.
Yep. Yeah. And all of this stuff about, as patients with bipolar disorder, sometimes we feel this too from our clinicians of, can I trust what you're saying? Are you actually doing the things that you're telling me? Just there's this level of real like suspicion and derision that we
Yeah.
face as
Right.
people with bipolar
Right.
disorder in the world. So that was one piece of it. And I did actually, well, when I was in residency and I had to be out for those long periods of time after the day night switches, I did consider, like, should I send an email out to all 100
Mm,
residents who are in this program at the same time as me, because they were being pulled in to cover the shifts that I couldn't take,
mm.
right?
Right, right.
And they had no idea why I was out. And the culture in medicine is very um, transparent. I
Mm,
remember other people being out for physical health conditions, and things like their imaging would be on Facebook so that
wow.
everybody knew exactly what was happening, where they were in their treatment progress, and when they might be coming back. And for me it was this big black box. And not only did that invalidate in some ways my need for time away, but it also made it very easy for people to
Sure.
read into that black box like,
Sure.
oh, well, we're all burned out. So surely, like, maybe this is just she wanted a vacation, a long
Right.
vacation, and
Right.
she
And
can't
you
she
felt
can't
guilty
be here right now.
probably. Yeah. Like you're like, no, there's
Yes,
a
yes,
real
and it makes
reason. Yeah.
totally. And I don't think that everybody would have been empathetic necessarily, but I think it would have made enough of them feel like there was a real and legitimate reason
Sure.
for me being out.
Yeah.
But I brought that up because I was given the advice, well meaning, by my program director, by my psychiatrist, that this is not the right moment for you to come out in this way. Because
Wow.
if you put it down in writing and you give it to all 100 of your colleagues, it will, or it could, be the reason down the road that you don't get a job that you're looking for. And so they
Wow.
were like, you should put this away. And I understand the impulse and I understand why you want to do this. And that's all good and well, but this could have more ramifications for
Sure.
you down the road. You're early in your career.
Oh, that just makes me like it makes me sick. Yeah, I mean like yes, there is a good
Yeah.
reason and I totally understand and I'm someone that I feel like word vomits every issue that I have and every problem right away to people that I just meet and sometimes I'm like, "Oh my god, why didn't I just take a breath?" So like yes, that was good advice for you to just take a moment and like be like, "You know what? Let's focus on what I'm doing right now. This is not relevant in this moment, and then we'll get back to it." But wow, I mean, the
Yeah.
pressure for you just to be going through all that you're going through, like with residencies and all this stuff. And then on top of this, having this like almost the secret that you're having to keep to yourself and trying to
That's what it
heal
was.
and help, without the
Yes.
help of others and understanding and compassion and empathy. I mean, that is just exhausting.
Yeah. Yeah, and I'll tell you this, maybe you'll relate to this. It made me feel like I was faking
Yeah.
because you already have with a diagnosis like bipolar disorder, there is no objective biomarker. There's no kind of way of being certain um, where you are from a biological standpoint in
Right.
your recovery journey. We just don't have that data right now like we do for, diabetes or HIV
Right.
or cancer or seizures, right? We
Sure.
know
Sure.
exactly for most seizure types exactly what's going on, where the discharges are happening in the brain, and really what to do. And we just don't have that yet for bipolar disorder. So it's really easy to get in your head and feel like, ooh, if I just wanted to try a little bit harder, if I just wanted to make this a little bit better for myself, could I?
Yeah.
And creating a circumstance where you can't talk about it
Right.
makes that self stigma and that sense of invalidation around your experiences much, much
Oh,
worse.
100%. So what was the moment for you where you were like, "Okay, you know what? Now is my time and I'm gonna share this."
So, last episode being in 2015, what happened is as I moved forward in my life and in my career and in my personal um, relationships and just feeling a sense of stability and that I was moored again to me,
Right.
that I hadn't lost that person to this illness, and that I had these reliable and predictable ways of managing the illness and keeping it at bay. And it wasn't just going to rear its ugly head
Right.
one day. I mean, all of that, just staying well for years and years, made it feel okay
Mm,
to one in my own narrative about my life and who I am to say, okay, this is a piece of it, but it's not all of it, right?
mhm.
It was not any more in the foreground. It was something that was sort of in the background that I thought about for a preventive function kind of on a day-to-day basis, but
Right.
I didn't fear it anymore.
Right. Right.
And so I think that led me to a place where I would say maybe around 2020, 2021, I was feeling very comfortable just disclosing to colleagues, hey, we're setting up the ACEs Aware Initiative in California. It's this huge million, multi hundreds of millions of dollar initiative where we're addressing childhood trauma and its impacts
Wow.
in people from, the age of 0 to 64. And it felt very relevant to lead with the lived experience that I had that
Sure.
helps me understand what people needed and what people might benefit from in a different way. And similarly, in my personal life, I had become increasingly transparent about this part of my journey because I wanted to do that stigma reduction work.
Sure.
And when I was appointed chief health officer initially in the California Surgeon General's office, it was the it was that role was between 2019 and 2020. So I would say like that was sort of my ramp up period where I was starting to, all of the circles of people in my life were slowly and comfortably starting to become in the know about it. And it was
Sure.
a very matter of fact thing. And then when I was appointed acting surgeon general in 2022, I was like, okay, it feels like the right moment in my life, personally
Mm,
and professionally. I feel like I'm now ready to speak this truth publicly. And so I
I
actually
love that.
I had a sense um that the period of time would be about, it was 7 months in total.
Yeah.
And towards the end of that period of time, I was invited to give NAMI California's keynote
Right.
address to their annual conference. And it was, hundreds of people in that room. And so what I decided was this is the right moment. This is the right stage.
Yeah.
NAMI is such an inclusive and family like feeling.
Yes.
So I wanted to do it for the first time there. And that was on August 26th. And the piece that you alluded to, which came out in the LA Times, it was called I Am California's Acting Surgeon General and I Have Bipolar Disorder.
Right.
That piece came out the same morning as my keynote.
Oh my
And then I
gosh.
put out,
Wow.
yeah, and I put out some messages and a video on social media across my channels on the same day. So it was this like big kind of moment, right? And
Wow.
suddenly everybody knew. I remember within a few hours of putting out the tweet thread that I did with the video and some messages around the stuff that I had talked about in my op-ed and in my keynote. I remember checking on that, and within a few hours, it had hit 1 million
Oh my
impressions.
gosh.
And yeah, and the LA Times, the op-ed had reached millions more,
Right.
right? So it was just this big moment, and I felt surprised, to be honest, at how big it was, but also just humbled and
Yeah.
gratified because so many people after that moment reached out to me to share their stories. I'm sure
Right.
this resonates with you,
Yeah.
as someone who's also been public with yours.
So wild because there are so many I have to tell you, like, there are multiple people in my neighborhood that I am friendly with that have reached out since hearing that I had a podcast and, talking about my mental illness and them saying, "Oh, I think a friend of mine might have this," or "A coworker has this. How do I approach them with this?"
Right.
Or "A child has this. What should I do?"
Yes.
And I think people are not aware of how many years it takes to be properly diagnosed. But I will say, the more that those who live with bipolar disorder share their own stories, I think the shorter we're going to find and the quicker things are going to be diagnosed. Because I mean, this happened to someone that I know where their kid was put on antidepressants and it made their highs higher and
Mhm.
lows lower. And I
Yes,
said to
that
them
happened to me too.
immediately, because it happened to me, I had suicidal ideations and I was not someone that was suicidal. And
Mm.
and I had said, something's not right. And when this person had approached me and was talking about this, and they said, "Oh yeah, it made their child, off the spectrum, right? A higher, higher, and low, low." And I said, "I really, truly, in my heart of hearts, everything that you're saying," I said, "I'm not a doctor, but I really recommend you asking about bipolar disorder. Like, just bring up that one."
Yes.
And you do. And immediately the doctors would be like, "Oh, yeah, that's right. Like, that sounds way better of a fit." And it's like, wow. Like, but we don't have you wouldn't even think it was bipolar disorder if you had no
Yeah.
idea what was going on or what it was. And,
Yeah.
getting back to you talking, when you made your big announcement at that time, you were the acting surgeon general, or you had already, I can't remember the timeline of that.
Yeah, I was.
And
Mhm.
were you scared at any moment when you were going to make this announcement that California was going to be like, "Well, funny that you're living with bipolar disorder, but that's not going to happen right now." Like, were you
Yeah,
worried that, oh my
right.
gosh, there was going to be any, not backlash, but like any like resistance like to that, or what was that like?
So internally in the government, I had shared this with everybody. So there were no surprises
Right.
internally. Okay, so everybody was in line with what was about to be shared, but I didn't know what the public would say, right?
Mm,
And surprisingly, the people who had a lot of negative feelings about it mostly kept those feelings to themselves,
right.
which I'm grateful for and surprised by, to be honest. I had maybe 2% of the overall response being sort of negative or questioning my abilities as a public leader, et cetera, which was much lower than what I had anticipated and been prepared
Sure.
myself for. Um, so yeah, I mean, I think I had all of the fears that you're alluding to about what's going to happen. Are people going to suddenly see me differently? And it didn't happen. It felt like the people who wanted to talk with me about what I had shared wanted to do so from a place of understanding and building on the movement and
Sure.
including me in that movement in a different
Sure.
way, in a new way, which felt really meaningful. So
Oh my
I felt
gosh.
like I came out of it with all of these partners and a family essentially of
Right.
people who believed in the stigma reduction movement.
Right. Oh my gosh. On a side note, what was it like being the acting surgeon general of California? What was that like? A lot of pressure?
Oh man, it was. it was, oh man. So I have a newsletter and I've written about the imposter syndrome
Oh,
that I
wow.
felt as I was coming into that role, because I'll tell you, I was, let's see, 35 when I was appointed, and then 36 as I was serving. And I had a baby under the age of 1. I had just come back from maternity leave. So I was really reacclimating to, where we were, what things were going on,
Sure.
what I needed to pay attention to again. And then suddenly, my then boss, Dr. Nadine Burke Harris, who served as the first California Surgeon General, decided that it was her time to wrap things up. And so the baton passed to me. And that was in a lot of ways, a very natural fit, as I'd been, her right hand as
Right.
chief health officer and setting up our office and
Sure.
setting up the ACEs Aware Initiative. So the work sort of felt like a natural progression in terms of passing that baton. But there were tons of new skills that I had to grow into, including giving legislative testimony,
Mm.
opening public meetings, getting up on big stages, giving keynotes,
Wow.
all of these kinds of experiences, talking to the press, right? um, Creating public service announcements,
Sure.
from a place of of trying to summarize what we knew and what would be most useful to families. And some of that work I had already been doing.
Right.
I
Right.
had been helping to
Behind the
craft some of
scenes.
those
Yeah.
messages. Exactly.
Yeah.
So it was this moment for me to really trust my own instincts and my
Mm.
voice and grow into that. And so it was this, I look back at that phase as this real gift, because I I could have let the imposter syndrome really cower me
Sure.
and take that growth from me, but instead I was able to find this place of leaning into my potential and
Sure.
leaning into what I who I wanted to be in that role. And I think by the end of it, um I had grown by leaps and bounds. I had really, been able to develop this sense of self-belief,
Right.
first and foremost, of here's who I am,
Right.
here are what my stories are, here are how those stories connect to the larger purpose and to what Californians need to hear
Sure.
and learn about. um and it was just, by the end of it, it was a very joyful transition, but a joyful period of time where I had really um leaned into that growth edge,
Yeah.
and instead of being scared of it. So I wrote about some of the techniques that I used to really
Cool.
do that, to
Yeah.
bolster myself. One of them was having kind of that positive alter ego where you
Yes.
visualize yourself doing something really well, right? Lots of people do this. Beyonce does it.
Yes.
She's got she Sasha.
Sasha Fierce.
Oh, thank you. Yes. And Michelle Obama has talked about having imposter syndrome and getting into that place as well. Like all of these women that you and men that you associate with just badassery have
Sure.
actually we've all been in that place where we're like, ooh, can I do this?
Right.
Am I the right person to
Right.
do this?
Right.
And and being able to be your own best friend, counter some of that negative self-talk, and bring into focus that vision
Mm.
of what it looks like to see yourself succeed and really inhabit that, instead of from a place of fear,
Sure.
really coming at it from a place of hope,
Right.
right?
Right. Right.
And belief that this could happen. Like the Marines do that. I mean, as part of their
Yes.
preparatory work for missions. They visualize it going well. They
Right.
visualize themselves in that moment of success. So this is a proven technique that works across sectors. So that was one
Visualization
of the
is
techniques.
powerful, man. It's very, very,
It
very
is.
powerful. Well, speaking of, you talk about how you had, a less than 1 year old when you were doing this huge job. What was your journey? A lot of the questions that I get, and it's funny, you and I are part of, it's not funny, but it is funny. But we're part of the
Mm,
Reddit AMA Ask Me Anything, for World Bipolar Day. And
yep.
it's what's funny about it is that there's questions that are written in that are obviously for doctors, and then the ones that were written in from the personal experience and kind of the more fluff questions, I would say, are sent in my direction. And those questions that I got a lot of this past year were ones that I hear all the time of, what was your decision to get pregnant? Why did you decide to get off medication before you got pregnant? What would you
Yeah.
say to somebody who, and then we can get into this too, because I'm so fascinated about this. What would you say to somebody who chooses to breastfeed opposed to staying off their medication and breastfeeding their baby? All these questions about the maternal mental health side of it all.
Yeah.
And so, from a doctor and someone who has lived experience, which is very rare, and a woman who went through a pregnancy and went through, breastfeeding and this whole journey, I would love to know from your side, like, what was your decision to do this, and how were you so confident in that decision and with your mental health and everything? Because it was probably one of the scariest journeys of my life in the best possible way.
Yes.
But it was scary not because
Yes.
of the actual pregnancy and the baby. It was scary because I had no resources. I had no one to talk to. I was searching Reddit, I was searching TikTok for lived personal experience. And I feel like anytime I
Mm,
would talk to my OBs and talk to doctors, they would be like, "Oh, we don't really know how to handle someone with bipolar disorder and pregnancy." And
right.
so what is kind of from the professional side and personal side,
Mhm.
your experience?
Yeah. I think, first of all, there is such a dearth of good information, research, and then doctors who are comfortable with that research in terms of managing mental illness through
Sure.
pregnancy. And there's a whole branch of psychiatry called perinatal psychiatry,
Yes.
Perinatal. And there are some amazing centers around the country. And
Yes.
so what I would say is if you are somebody who has a serious mental illness or a mental illness, let's not mince
It
words
doesn't
about it.
yeah.
If you have any kind of mental health needs and you're considering pregnancy, if you live within like a reasonable vicinity of a perinatal health center, I would encourage you to get an in-person or a remote consult with a perinatal psychiatrist, because I think outside of that field, there are still a lot of fears and fear-based thinking that goes on
Yes.
where people are being taken off medications that would have actually helped them be really healthy and stable through a
Sure.
pregnancy and postpartum period. Wrongfully so in many
Yes.
cases.
And a lot of people who are, I don't mean to interrupt, but a lot of people who never had a mental illness or never had mental health
Mhm.
crises, and they come
Could
through
have
their
one for
first
the
and
first
second,
time.
exactly, and
Mhm.
that is truly terrifying. Because the one thing I will say is I was so blessed about was that I had been through this. Like, I had been through that mental health
Mhm.
journey. A lot of women,
Yeah,
it comes out of nowhere and they're like, "What? Who is this
right,
person?"
right. In some ways, those of us who have already traveled the road know what it takes to restabilize,
Right.
even though it's a brand new context.
Sure.
So we
Sure.
enter at least with some self-knowledge, some knowledge about what we're dealing with in terms of our illness. And when it comes at you for the very first time while you're trying to figure out a brand new human and
Yes.
your relationship with that human and taking care of that human, that is the hardest. That is
Yeah.
so, so tough. So so getting a perinatal psychiatrist to be involved is really important. Number two, I think there's so much pressure on parents and specifically mothers
Yes.
to do things right.
Right.
And the truth of the matter is, like, we have this culture of, we look to our colleagues, we look to our friends, we look to our social media communities to say, okay, what is the right thing for me to
Sure.
purchase? What is the right thing for me to do? What is the right way for me to feed? But honestly, I think the very true truth about all of that is that there is no one right way
No.
to parent, to take any of these decisions.
No.
Everything has to be in your context, in your way. You're going to be the best parent you are supposed to be for
Yep.
your kid because of the decisions that you make individually. And I think it's so dangerous for us to feel like there is some bar that we
Mm.
need to meet, otherwise we're not good enough parents. And I think part of that, as we think about what it takes to stabilize and stay well through um, the peripartum postpartum period, as somebody with bipolar disorder, we've talked about being really sensitive to sleep loss and
Yes.
circadian rhythm shifts. And so for me, my psychiatrist is basically like, all right, you're going to stay on your meds. Okay, so she was a general psychiatrist with some perinatal um, training, and she ended up taking care of a lot of patients around this time period,
Oh,
and
great.
so had a lot of insight and expertise in that area. And so she was like, "All right, staying on the meds, that might mean extra, screening for the baby to make sure there's no kind of developmental issues or." Um, any structural issues because I'm on lithium. So that was one of the meds I stayed on through the
Okay.
pregnancy, and that can cause a very rare anomaly of the heart. So we did an extra anatomy scan
Okay.
to make sure that that was not going on. And for the most part, super stable through pregnancy. Peripartum, postpartum was a little bit rough, but stable through that. And the big technique for me when I was postpartum was sleep protection, sleep protection, sleep
Mm,
protection. So what we did there was, number one, we were fortunate enough to have funds for a night nanny,
right.
right? And so someone who came in and for the first 2 to 3 months when our baby Rumi wasn't yet sleeping through the night to help take care of him overnight, right?
Right.
Feed him, change him, all of that
Sure.
stuff. And so what that meant was I was sleeping through the night every night without feeling like I was overburdening
Sure.
anybody else,
Sure.
sort of in the family. And so that was one. The second one, which people, this surprised me initially, and so this might surprise some listeners, was that I was given the recommendation by my psychiatrist to not breastfeed.
Mm,
Okay.
hmm.
So here's what you have to understand about breastfeeding. And you know this.
Yeah.
But when you're initially setting up your supply, right, you want to have enough milk to feed your baby. What you need to do is every couple of hours, you need to be either pumping or feeding directly.
Right.
Otherwise, your supply is not going to come in.
Sure.
So what does that mean? If you're a breastfeeding parent, even if you're, pumping and putting some milk away and letting somebody else do some of the feeds overnight, which does happen over time, you still at the beginning need to be doing some stimulation
Yep.
directly of the breast, which means you need to be awake every couple of hours through the
Sure.
night, which means you're not going to get an uninterrupted night of sleep
Right.
for the first several days to weeks,
Yeah.
right?
2 months.
And for
2 years.
yeah, and for people who have bipolar disorder, that is a
It's rough.
huge risk.
Yeah.
It's a huge risk. There's very little way you're going to actually stay stable. And
Yeah.
it's not just people with bipolar disorder. It's really anybody with a mental health condition,
Or
anybody with a
anyone,
health condition
period,
that is
just with
induced
sleep.
by sleep loss.
Yeah.
Yes. Yes. Anyone who's never had a mental health
Yeah.
condition, but suddenly is facing this level of sleep loss that they've never had to experience ever before.
Right.
And that combined with all of the other risk factors of like, am I a good enough parent? Am I doing this right? Am I, all of this stuff? Because they're, culturally, we think of moms, especially as these sacrificial martyrs, and we think,
Yeah.
okay, the baby's needs trump my own.
Yep.
And I need to be losing all this sleep. I need to be in this amount of pain to be giving my baby the best milk.
Sure.
But the truth of the matter is, I looked into all of the data because I've been trained as a pediatrician, I've been trained in the breast is best model, right? Of whenever possible, get your families to understand that breastfeeding is the best thing they can do and try to get them to do that exclusively for 6 months and then longer if they can, meaning supplemental breast milk after 6 months. And honestly, when I started looking into the data, I was really surprised to learn that the only benefits to the baby that are borne out by randomized controlled trials where they assign one group to breastfeed and the other group is just the same
Mm,
as the assigned to breastfeed group, but they've assigned that group to formula feeding. In those contexts, the only benefits to the baby were a slight reduction in diarrhea in the first few weeks of life and a 3 to 4%, like real slight, and a slight reduction in skin rash called eczema,
okay.
similar 3 to 4%. And literally everything else we hear about, intelligence, bonding, diabetes, obesity, all of these other health impacts for the baby, those turn out to not be true when you look at the randomized
Wow.
trials, because we do cite those kinds of
Sure.
effects, and those effects are actually from what we call observational studies, where we just
Sure.
look at the general population. We say, who is breastfeeding and what outcomes are
Right.
associated with breastfeeding, who is not breastfeeding and what outcomes are associated with those. Problem with getting data like that is that there is a huge difference usually in the families in terms of the resources and what they're set up to do, who are able to breastfeed long term. Like you think about the fact that many women are going back to work in 2 weeks.
Yeah.
And if you're in a circumstance like that, it's very rare that you're going to continue to exclusively
No, you
breastfeed.
can't.
So
Yeah.
there's all of these resource considerations where families that are able to breastfeed look very different
Sure.
and might have those other outcomes associated with those other differences
Right.
rather than of the breastfeeding. So when you randomize, you kind of take away those group differences and you can say, what is the actual effect of breastfeeding versus not breastfeeding? When you look at only those randomized data, it's not very convincing, to be quite honest. And so I actually did a whole podcast episode where I interviewed two perinatal psychiatrists, Dr. Nancy Byatt and Dr. Crystal Clark. It's called Spread the Light with Dr. Devika B. It was our January episode. And I
Cool.
basically had this conversation of like, what the heck is happening? Why do our guidelines in the OB world, in the pediatric world, in the public health world, WHO says this too, why don't they really reflect what the data is saying?
Right.
What's going
Right.
on here? And it was all about like, well, there's all this embedded structural stigma in the way that we formulate these things because there is this narrative that's already gained favor of mothers must breastfeed. And there is some sort of, we're okay with the sleep loss, we're okay with the sacrifices, we're okay with the health impacts, and we're just not weighing those things
Sure.
as heavily as we should be. So anyway, so I wrote this piece also in Slate to come out at the same time as that podcast episode, which really summarized the experience of one mother, my own experiences,
Right.
and just to let people know, look, whatever decision you make is an okay decision to make. I formula fed from the get-go. My kiddo, I mean, I'm not saying this to brag. I just, want people to hear this. Like, he is thriving.
Yeah.
He is really developmentally advanced.
Sure.
And he's been formula fed. You know what I mean? Like, it's just, there is no wrong decision. If you want to breastfeed and it's working for you, go for it.
There
Amazing.
is no wrong decision. I had a friend who, chose to get off her medication when she was pregnant and then got back on her medication and so did not breastfeed, And I think one of the things that she would say to me a lot, when I pulled my boob out, and everyone's seen my boob at this point, and I'm
Mhm.
breastfeeding, she said,
Yeah.
"Oh, I feel like I'm not like, is the bonding there?" I said, "Honestly, you're the best mom. Your kid loves you just as much as mine does. This is a pacifier. This is not a bonding mechanism. Like at this point, you know what I mean? Like this is called an
Mhm.
addiction. and my
Mm.
daughter's addicted to
Mhm.
it because it's like her pacifier. It's her binky. It's
Yeah.
her, it's her lovey, And I said it has nothing to do with that, And I'm a firm believer in whatever you need to do for yourself and for your baby, whatever that best combination is, you do that. There is no judgment
Amen.
on this side. I have
Mhm.
a quick
Yeah.
question for you because this is my own personal fear. When
Yeah.
I, when we went through with one of my friends who's a neuroscientist and a few other doctors, and when I came out with the People magazine article talking about how I, got off my medication before I got pregnant, and it was a decision, and I weaned off my medication months and months and months before, and I was being, monitored and all this stuff. The thing is the other argument, let's say the other side of the story was from these doctors, and they were saying that it's a point whatever 0.8% chance that there was going to be a cleft palate if I stayed on my Lamictal, possibly with a baby.
Okay.
That wasn't
Okay.
my issue, but my issue was, for me, my own sanity is why
Mhm.
I got off it,
Mhm.
because I couldn't deal with the fact if something, God forbid, knock on wood, happened to my daughter, I would have always blamed myself for the rest of my life. That's my own internal issue. That is not for anyone else. That is just my own issue. But was there
Mhm.
ever a
Mhm.
question when you stayed on your lithium where you were like, yeah, there may not be a
Mhm.
physical, deformity, if you will, but how could you ever test if there's something with the brain? Like, was there ever, like, did you ever
Mhm.
have that? That's my own OCD, fear,
Mhm.
anxiety. But like, did you
Mhm.
ever feel that way? Like, or am I the only one
Yeah.
who thinks about it all day long?
To be honest, yeah, no, it's a really good question because what you're getting at is we just haven't had people going through pregnancies on these meds for long enough because
Right.
um, a generation ago, the advice was always get off your meds
Yeah.
and then get pregnant. And then people realized that it just wasn't working
No.
because people were not staying well. And meds are such a big part
Yeah.
of that stability, that rock, that anchor for the brain. And so to be honest, I didn't really let myself go there of like, what don't we know about the way these meds might impact the growing brain and all of those pieces, because I knew that the risk was so high, like more than 50% chance of relapse if I were to get off of them, that that was going to be an almost certain
Sure.
impact on me and then on my baby, because he was not going to have a mom
A
for
hundred
months
percent. Yeah.
while I got stabilized. And so I knew that it would be better for him and better for the whole family for me to just take the risk and stay put. And they've done, I mean, there's been enough people who have been through pregnancies on lithium for them to know, okay, we have this small risk of Epstein's anomaly, this heart condition, right? Small risk. It's like 0.000 something.
Yeah.
Um, and so similarly, they know that there haven't been any conclusive like impacts for the brain or for development or for any of those other markers of what of a baby thriving and doing the things they're supposed to do. So I felt, even though it's not 100%
Sure, sure,
watertight, I
sure.
felt comfortable enough.
Yeah,
Yeah.
no, and I appreciate you so much for sharing that with me because that was my, that was one of my biggest fears is,
Yeah.
I'm always someone that lives in fear, and that's a problem of mine, but we have a lot of history of autism in my family. There's a lot of history of mental illness. And so for me, I'm always just it's the control aspect of like, oh my God, I can't live with myself if A, B, and C.
Hmm.
And
Hmm.
that's my own
Yeah.
issue of like going to therapy and talking through that. But that's kind of where I'm at. So I love hearing other women's stories of being so brave and being so open and sharing. And you have helped me, you've helped so many women out there. I guess my final question for you is, what do you do, for your child to implement healthy mental health conversations like at such a young age? Is there something that you would recommend to new moms, maybe talking about it in a very open way, maybe not
Hmm.
sharing yet? Like, what is kind of your, like, from a pediatrician and mom advice, what would you give to new
Hmm.
moms?
Yeah, I love that question. I think our kids understand and pick up on so much more than we give them credit for, and they are capable of handling information that is pretty complicated and advanced at fairly early ages. And so I've been a fan of just talking my kiddo through whatever
Sure.
that feels a little bit like out of his grasp, potentially at the next developmental stage, and then kind of breaking it down in language that he can understand and seeing what he does with it. And he
Yeah.
surprises me a lot of the time by understanding it. Like, for example, I've always been of the mindset that I'm never just going to say, like, this is not allowed, this is a thing that you can't do, without explaining to him exactly what the reasoning is.
Huh.
Even when he, was, 1 and 1.5, and he
Sure.
couldn't necessarily rock exactly what I was explaining, but he understood enough to know that she trusts me, she respects me,
Mm,
there's a soothing, calming, rational explanation for what
sure.
and why, and when I can do X. So just using that exact same model, I do talk to him about my health and my needs, and stuff that my husband needs for his mental health,
Mm,
things that I need for my mental health. For example, my husband is a big runner, and so we almost always make it a priority on weekends, for example, or like if it's after work, to give him that time to go and do what he needs to do for himself. And
sure.
we never frame it as this is an optional thing. We always say, okay, Papa's gonna go for his run and he's gonna feel so much better, and then he's gonna come back and join us for dinner. Or for me, every night I take meds, and sometimes I help sometimes Rumi, my son, helps me sort my pills into my
Oh,
pill box, and he
cute.
really enjoys that.
Yeah.
So, something very small like that, just being matter of fact that, hey, mama needs to take these medications to stay healthy, to stay herself, and it's normal to take meds. It's okay to take
Sure.
these, and similarly around like processing difficult feelings. Like if one of us, is feeling really stressed about something, we just talk about it. We're like,
Mm,
okay, here's what's going on for me right now, and this is why I'm feeling really stressed. I'm really sorry that I snapped at you. I didn't mean it. It wasn't you. It was me
right.
processing this emotion. And so just like being very forthcoming about difficult feelings, them being okay and normalized, and
Sure.
just talking through them, and coming from that place of, okay, we are not always going to be perfect, and it's okay to hold space for that, and it's okay to come down and do the repair from that.
Sure.
So it's not
Sure.
even just like mental illness related,
Mm,
but it's how do you optimize mental health and sort of
right.
emotional um, fluidity and
Right.
conversational elements around that. So
Oh, I love
yeah,
that, and
those are
I
some of
think
the
it
things I
is
do.
being super open with your kids. You're right. Like they know so much more than we give them credit to for, and they also
Hmm.
are able to grasp and understand things way more than we think. I mean, I will say stuff, and I'm like, "Oh, I don't think Lady gets it," and then she like repeats it in context,
Yes,
and you're just like,
right.
ma'am, what do you
Yes,
mean? Like, how do you remember that? Like, how do you know that?
exactly.
So I think that that's right, is like having that open dialogue, having that conversation,
Yeah.
and just, and including them. I think that's so important. Like, I always like to
Hmm.
tell people, like, remember when you were a kid, like, what were the things that you wanted? What were the things that you wanted? Most importantly, were to be
I
treated
love
like
that.
an adult, and not like an
Yes,
adult, but
yes,
listened, heard, understood. And so
right.
like we just have to keep doing that for our kids.
Totally.
Oh my gosh.
And one other thing I just point out is like
Yeah.
kids rise to the expectations that we have of them in some
Yeah.
ways, right? Like, let me give you one small example. Last night I was putting on the shower. Well, I was trying to fill the tub for him, but what ended up happening was it was accidentally on the shower mode, and
Yeah.
he got pelted with this like hot water, and he started crying and
Oh,
wailing. And so I was like, okay, Rumi, like I understand that was a
sure.
shock. Do you feel like you're hurt, or are you just surprised? And he stopped crying. He thought about it, and he was like, no, I'm just surprised.
Yeah.
Because he said it in his toddler way of like, I just surprised.
Oh,
Um, and he was like, okay, yeah, that makes sense. Okay, yeah, that's a thing that, okay, yeah, I don't have to feel that upset about.
right. Right.
And I
Right.
just expected that, like by
Yes.
asking him that question, and he rose to that, right? Like you might expect a 4-year-old to be able to do that, but
Yeah.
he's only 2.5. But it's like sometimes when you give them that opportunity of of processing something in a more
Sure.
advanced way, or processing something that a little bit of an older kid might do, you might get surprised
You might be
that they
surprised,
could
and
do
it's
it.
honestly, it's so much easier for them in the long run to then feel comfortable around you of expressing emotions and
Yeah,
talking through things and crises, like to actually think about it. The thought process of,
totally.
of a child is just mind-blowing, and every day I'm just
Yeah, it
so
really is.
pleasantly surprised over and over. Well, Devika, I'm going to ask our final question. What is your emotional support?
Ooh, that is a great question, and I knew that was going to come too,
I
but
know, but it's always a
I'd
surprise for
say
people.
okay. Well, I'm somebody who really likes to talk through small and big moments
Mm.
of angst, if you will. And I will say, so my husband, he and I have now known each other for 20 plus years. We've been
Wow.
together for 18 of those years. So we've been through all of the ups and downs of life on both ends together. And the thing that happens when you meet someone when you're 18, you start dating them when you're 20, and now you're 38 together as parents, is that you can either grow in completely different directions, or you can sort of guide each other's growth
Sure.
around what each other needs. And that's what's happened to us. And we are so lucky, and I
Yeah.
feel so lucky that he is that emotional support for me on a daily
Yeah.
basis of, okay, this bizarre thing happened in my day, and I need to process it, and just talking it through is so helpful. And then I'm also a big I love walking outside and being exposed to the sunlight and the fresh air and the bird song, it really helps me de-stress
Yes.
and just get out of my head a little bit. And so I try to do that every day. And I'm a big believer of like building these into your day as and when it's appropriate and able to work. So
Sure.
for me, when I'm walking to daycare to pick up my kiddo, that's my time for
Yeah.
myself. I might, take a few extra walks around the
Yeah.
neighborhood, depending on what I'm needing to do that day. And then the last thing I would say um, is I really get so decompressed and relaxed by massage,
Mm.
sensory
Yes.
manipulation and support. I carry a lot of tension in my muscles. That's just how I process stress. And so that's a big stress reliever for
Oh,
me.
I love that. Well, thank you so much. I'm going to have all the links to your website, to your Instagram, all the socials in the show notes. So be sure to check that out and listen to your podcast and read all the articles and subscribe to the newsletters. Like, just do it all. I promise you will not be disappointed. You will be so happy. So thank you so much.
Thank you so much for having me. This was so much fun.